This is a 73-year-old patient who called me because she noticed blurry vision after lifting some heavy weight. She had a history of a previous vitrectomy 20 years ago and a cataract surgery with a toric single-piece acrylic IOL placed in sulcus with a posterior capsule break. And I told her, go home and sleep with 2 pillows, and she had surgery the other day. First of all, I stretched the pupil using 2 iris hooks. Then I put some viscoelastic, and with a 30G needle, I lift up the dropped IOL, and with a microforceps, I grab it with the other hand. The IOL was completely luxated to the anterior chamber by doing this maneuver, keeping attention in not touching the endothelium. It was made under subtenon anesthesia. At the slit lamp, I could only see the IOL if I look up and down fast, and I see an aptic coming down behind the iris. Due to the small pupil, I wasn't able to see the complete IOL, but I know it wasn't in the posterior pole when I look with a 90D lens. After that, the IOL was cut in pieces and take off the lens. I used the spatula to protect the IOL of touching the endothelium. And then I proceed inserting a 3-piece acrylic hydrophobic IOL. And as I noticed intraoperative, the anterior capsule was not intact in the superior part, so I decided to suture one haptic and the other one leave it in the sulcus. I use a 10-0 Prolene suture to do this. I go through the iris, then behind the aptic, and then I go out to the iris again. I previously made a paracentesis where I took out the ends of the suture, and at the end of the case, the IOL was centered in place, and the patient didn't complain about the residual astigmatism. First, I luxated the optic to the anterior chamber so I can notice the haptics going through the iris. It's an easy and friendly approach to a luxated IOL for anterior segment surgeons, and if you don't have an access to a retinal surgeon or you want to do a perhaps less invasive surgery, I think this is a good option. Also, this patient didn't need anterior vitrectomy as she have had a vitrectomy before and there was no vitreous traction.